Avian influenza, or bird flu, is a disease caused by type A influenza viruses that mainly affects birds. The natural reservoirs or hosts of these viruses are wild aquatic birds, such as ducks, geese, and swans. The disease can also spread to domestic birds raised for meat, such as chickens and turkeys. Avian influenza viruses are classified according to two broad categories based on the clinical forms of the disease they can cause: high pathogenic avian influenza, HPAI, and low pathogenic avian influenza, LPAI. HPAI viruses cause severe systemic infections and can lead to very high mortality in farms, at times killing the entire flock. The clinical signs vary and depend on various factors, such as the aggressiveness of the virus or the susceptibility of the infected species. These include lack of appetite, dullness, lethargy, and comatose states, respiratory symptoms, diarrhea, edema, and cyanosis, soft or discolored eggshells, and a fall or halt in egg production. The disease may also appear suddenly, causing the abrupt death of many birds without any warning symptoms, particularly in more susceptible species such as turkeys. Conversely, LPAI viruses give rise to asymptomatic or mild infections with predominantly respiratory symptoms unless the situation gets worse due to bacterial co-infections or other concomitant factors. Specific laboratory tests are performed to establish whether a virus is HPAI or LPAI. RNA sequencing and genome analysis determine the severity of the disease, the ability of the virus to spread among domestic birds or other species, and any similarity to viruses identified in other outbreaks and previous epidemic waves. When an avian influenza virus is identified, health authorities take the most appropriate measures to control its geographical spread, including movement restrictions, the slaughter of infected animals, the destruction of contaminated material, depopulation of areas at risk, and controlled vaccination. The scope of these interventions varies according to the type of risk identified and does not concern only highly pathogenic strains. Some viruses can mutate from LPAI to HPAI, making it important to promptly control outbreaks caused by these viruses.